Hi, good morning. Again, I'm Crystal Totten from the University of Kentucky. The research was supported by a grant from SAGES. We know that 2 to 20% of laparotomies performed will develop an incisional ventral hernia. There's a connection between the occurrence of incisional hernia and abnormal collagen metabolism, as well as in extracellular matrix diseases. The main structural component of the ECM is made up of type 1 and 3 collagen, and for a stronger ECM, we need a higher ratio of type 1 mature to type 3 immature collagen. Collagen metabolism is affected by the presence of collagenases, or matrix metalloproteinases. I'll refer to them as MMP moving forward. Lower levels of MMP increases this 1 to 3 ratio, and we know that from prior studies, MMP2 degrades type 1 collagen in the early stages of wound healing. Doxycycline, a modified tetracycline, not only has its antibacterial properties, but it also inhibits the conversion of pro-MMPs to active MMPs. In prior studies at our institution using polypropylene mesh, we noted that oral doxycycline can increase type 1 collagen. It also increases tensile strength and will reduce MMP 2, 9, and 3. Thank you. For this study, we elected to test our model using a porcine acellular dermal matrix. We use Zen matrix, hypothesizing that the biologic mesh would serve as a scaffolding and enhance the abdominal wall fascia in terms of strength and durability. We did a randomized control trial using 32 Sprague daily rats that were 400 grams. They underwent a hernia creation surgery where we incised the linea alba by 4 centimeters with a skin-only closure. After 4-week healing time, they were randomized into 2 treatment arms for oral galvage, which was normal saline versus doxycycline, 10 milligrams per kilo. And then mesh type, PP versus biologic. They then underwent a hernia repair surgery, which was a bridging underlay with a 1 centimeter overlap. They continued on their oral galvage per treatment arm for 8 weeks and then were euthanized and tested. As you can see here, this is status post hernia creation surgery. This is after hernia repair. This is the diagram of our treatment arms. We started with 32, split into 16 for oral galvage. They were then split into mesh type. We did not have 100% survival at 8 weeks. You can see our differences there. We also performed Western blots for MMP2, 9, collagen type 1 and 3. We tested strips of the harvested abdominal wall for tensometric testing to determine the strength of the mesh fascial interface, and then performed histology as well. Is there a way to show the difference? Because it showed on your screen back there, sir. I apologize. There should be graphs here. They were on your screen on the PC. Well, I apologize. For the graphs that were here, you saw collagen type 1, which had actually increased in its values when we treated the biologic mesh with the doxycycline. The numbers themselves are 11,000 for the doxycycline and compared to 8,000 for the normal saline groups. There's a p-value of 0.04. The following graph that would have been on there, I'll just continue forward, it's okay. The following graph that is missing from there would have been the type 3 collagen, and in the type 3 collagen, we also had decreased expression in the biologic doxycycline group. Oh, perfect, sorry. This is the type 1 where we see that there's an increase in the doxycycline group compared to saline, and type 3 where we have a decrease in type 3 collagen in the doxycycline group, so a decrease in the immature collagen compared to the saline group. This is a histology slide showing more densely compacted collagen fibrils in the doxycycline group compared to the saline group. Despite increases in type 1 and decreases in type 3, we did not have a statistical difference in the tensometric testing. We also had increased over basal levels with MMP2 and 9 in the biologic group compared to the polypropylene group. These higher levels of MMP may be response to the xenograft itself, independent of doxycycline, as both of our biologic groups had elevated levels. We theorized this is due to debris from the decellularization process of the biologic mesh that actually reacted to the host immunosystem. This then produced pro-inflammatory cytokines, which increased the MMP levels, and this response can result in graft rejection. Limitations of our study is as a result of the biologic mesh, wound healing may differ compared to prior synthetic and our prior polypropylene studies with alterations in collagen deposition. We do not know the ideal dosing for the porcine graft. We've done prior dosing studies for polypropylene and noted that 10 milligrams per kilogram was the proper dose when compared to 8, 10, 20, and 30. However, due to the degree of reactivity due to the xenograft itself, the dosing may need to be higher. So in conclusion, doxycycline administration can improve collagen deposition in hernia repairs performed in a porcine acellular dermal matrix mesh. Overall, the type 1 to 3 collagen ratio was increased in the doxycycline-treated animals. This may have implications for mesh design, hernia techniques, post-operative drug therapies, but we do need further studies to determine the ingrowth, remodeling, and optimal duration. It's potential that if we continued the oral gavage past 8 weeks, the tensile strength would have increased as seen in prior studies, and also leading to the development of potential locally delivered systems in the future. Thank you very much.